Welcome to MNA Power and Practice, the podcast for all things MNA. This podcast is a tool for education, information, and making your collective voice heard as members of the Minnesota Nurses Association. Please note, the following episode includes sensitive topics, including sexual violence and sex trafficking, and may not be appropriate for all listeners. Listener discretion is advised.
Welcome to the Minnesota Nurses Association Power and Practice podcast. I'm Jerry Katz, staff at MNA, and I'm here today with Wendy Wahl, who's a registered nurse from Thief River Falls and a member of the MNA Board of Directors. And we're also joined by Evett Ellis, the Executive Director of Support Within Reach, a sexual violence resource center in Northwest Minnesota. Today, we're going to discuss the issue of the sexual exploitation of children. Specifically, how can nurses and other healthcare workers support survivors and be part of the solution? Wendy and Evett, first of all, please introduce yourselves and tell us a little bit about what brought you into working on this issue.
Hello, Jerry. My name is Wendy. As you said, I've been a registered nurse for right around 20 years. I am the person who crafted this resolution for the 2021 MNA House of Delegates. Child exploitation, I think that every nurse can agree, is just a horrible crime, and that society would be such a better place without the exploitation of children. And I think that it really is a unifying issue to work on, and it is something that is easy to find a common space. And when looking around at how our society is working to move in a direction that is seeking to end the exploitation of children, I see my role as a nurse that I have a lot of opportunity to make a difference, and I just want to give that opportunity to other nurses within MNA. I know that they, as well as I have been wanting these resources, and so we're just here today to share some knowledge and some of the resources that are going to be coming available.
My background, what got me working into this field of sexual exploitation of children. I'm currently the Executive Director of Support Within Reach. I've been there for about a little over a year. And prior to that, I worked 14 years for Tribal Social Services. And through that, worked with families, and exploitation has seemed to been the largest determining factor in a lot of the family scenarios. And it just seemed like, this is a topic that people see, but they don't truly see. It's there, it's happening, but no one's willing to admit that it's happening closer than they need to make or take action. So just in general, working with Support Within Reach, I was able to get more informed regarding our Safe Harbor initiatives and just the different areas within Minnesota that have really strong foundations and supports. And through that, just working in our service region, which is about 16 counties, we noticed such a high needs of contacts with children who have been exploited. And this is just something that's happening on the daily, and the community needs to be aware. And that's including all of our community partners and just our healthcare workers in general, just to kind of work as a collaborative to see what we can do to bring more awareness about the topic. And that is why I'm here, because I think it's really important for us to kind of work together and just kind of look at it from that specific spectrum.
Wendy, can you tell us more about why you brought this resolution to the MNA House of Delegates last fall, and how you hope registered nurses will engage with this work?
First of all, I want to thank all the delegates at the House of Delegates that moved this work forward by supporting the resolution to end sexual exploitation of youth. Unfortunately, we live in a world where we need to have these difficult and unsettling conversations. And in reality, as nurses, we have a responsibility to our patients to have them. Exploited and trafficked youth and their abusers are hiding in plain sight throughout Minnesota. And this preventable trauma experienced by children of all backgrounds throughout Minnesota follows each survivor throughout their lifetime. This crime has significant consequences to our patients and our society. And we as nurses have a responsibility to understand this patient population, not only because we are encountering them, but also because our own children are at risk for becoming part of this population. As nurses, understanding more about the ecosystem of sexual exploitation of youth really begins by busting some of the myths or assumptions that we have about child exploitation and defining or explaining some of the common language and framework that exists within this ecosystem of exploitation. Sexual exploitation and trafficking have been occurring for thousands of years in the United States, including Minnesota. In 1910, the United States passed its first law pertaining to sexual exploitation and trafficking called the Mann Act of 1910, which forbids the transportation of a person across state or international lines for prostitution or other immoral purposes. Since this time, sexual exploitation and trafficking have continued, if not grown, and there have been several efforts and laws passed to more effectively prevent, intervene, and assist victims and survivors of human trafficking. But before we can explore what is being done to evolve the ecosystem of child exploitation by working to more effectively prevent, intervene, and assist victims and survivors, we first need to explore the nuances within the territory of sexual exploitation of youth. Sexual exploitation is actually a broad category that branches off to include sex trafficking. A child who is trafficked is exploited, but a child who is exploited may not be trafficked. Let's define some terms and then it will make more sense.
The first broad category of sexual exploitation is the exchange of sexual activity for some form of consideration, for example, money, shelter, drugs. Exploitation often involves taking advantage of a person's vulnerabilities. Commercial sexual exploitation of children by itself is a crime. Commercial sexual exploitation occurs when someone exchanges sex for anything of value or a promise of something of value, such as money, drugs, food, shelter, rent, or higher status in a group or a gang. Sex trafficking is when a third party is involved in the exploitation. The trafficker's involvement includes recruiting, controlling, or profiting. Sex traffickers often use additional manipulation, grooming, and violence that results in additional long-lasting harm for victims.
Just to be clear, trafficking is one form of exploitation or abuse. Exploitation often involves taking advantage of a person's vulnerabilities. Commercial exploitation of children by itself is a crime. Commercial sexual exploitation occurs when someone exchanges sex for anything of value or a promise of something of value such as money, drugs, food, shelter, rent, or a higher status in a group or gang. Another person may or may not be involved in arranging this exchange. If a third person is involved, then it is sex trafficking, but both are crimes with significant harm.
Yes. Child sex trafficking, aka child prostitution, juvenile prostitution, and commercial sexual exploitation of children, survival sex, are among the most insidious abuses of children. There are many misconceptions about the ecosystem of exploitation. Many of the myths prevent the evolution of the system into non-existence. One big myth is that sex trafficking and sexual exploitation is something that only happens in foreign countries, big cities like New York or San Francisco, or in movies or some of the TV shows. The truth is, although child sex trafficking or exploitation is a global health problem, sexual exploitation of children is happening in every Minnesota county. In fact, Minnesota has the third highest rate of child sexual exploitation in the nation. In a press conference in January 18, 2022, Beth Holger, executive director of the Twin Cities-based nonprofit The Link, reminded residents that sex trafficking is occurring statewide. People in Minnesota like to think that sex trafficking doesn't happen here, that it's something that only happens in foreign countries or in movies or some of the TV shows. And that's just not true. Unfortunately, sex trafficking is happening every day in every community within our states. A 6-month study by local prosecutors found over 34,000 advertisements posted online for sex in the Twin Cities. But sex trafficking is not just a Twin Cities problem. Trafficking affects people from all parts of Minnesota. An online sting in southwest Minnesota led to the arrest of 48 individuals. One 16-year-old who was trafficked in northern Minnesota stated that she was exploited on average by 5 men every day, which means that she was exploited over 1,800 times in a year.
So children are being exploited and trafficked right in our own communities. Who's exploiting them? It must be strangers who come to town for big events or for job sites, right?
Another myth is that most sexual exploitation or trafficking is done by strangers. According to the U.S. Department of Justice, 86% of all sexual assault cases reported to law enforcement were committed by someone known to the victim. Approximately 47% are victimized by family or extended family. The U.S. Department of Justice reports that 93% of victims under the age of 17 were assaulted by someone they knew. 34% of offenders were family members, and 59% were acquaintances, so all people that were known. Multiple studies have shown that sex offenders often establish contact with their victims through the relationship with another person, most commonly an adult. For example, repeat sex offenders in one study use romantic relationships with women to gain access to women's children. Offenders can also gain access to victims through babysitting for someone they know or by living with friends who have children.
The statistics are pretty startling. Let's talk about some real life examples of people who knew their victims.
Yeah, well, I think the main ones that kind of stand out is the ones where we kind of talk about, just the ones that are not the norm. So like the grandma, because when you hear of grandma, even in social services or even, you have them as backups and they're the next of kin but they're the ones out there trafficking kids. And so that's like, to me, I think that stands out because it gets, it gets the workers to start to think that, oh, okay, I don't have to just look at the mom's boyfriend. I should be also looking at, the grandma, like everybody,
So, and I think the point that you bring up about the grandmother is such a great point because I think as nurses, many times when we have family members come into the back with us to the ER and there just seems to be a really quiet child and you're thinking, oh, you don't always know why they're quiet, and to think that, well, maybe part of the reason that when this pattern doesn't fit, that grandma's the exploiter. You're always thinking, like you said, of the stepdad or the boyfriend or the stranger.
Yeah, because we don't ever want to discount anybody, as being a possible trafficker or exploiter of those youth, especially when you're trying to get those basic needs met. That can be presented through various people, various individuals. And, just from back what we were talking a little earlier, a lot of times, the people that are exploiting the youth, they know them, they're friends, they trust them, they've groomed them to these spaces to, trust them enough to know that, okay, well, I shouldn't be speaking up or I'm going to be quiet. But it's important to recognize that even though that is grandma and that child is in grandma's care, grandma may not necessarily be the most appropriate placement for them, especially if you're noticing that. Why are they at the casino late at night? Why are they roaming around? What are some of these different behaviors that are going on? And especially when you notice that some of the behaviors are happening, and these are very telltale signs when you've been exposed to being exploited, especially for sexual purposes.
I think that also brings up the very important fact in all this research that was brought to my attention about that it can be a principal, it can be a police officer. I was just amazed at the different in the last 8-9 years, how many people throughout Minnesota have sprung up in these charges with the great work that the Bureau and all the law enforcement officers who have been trained to be very informed about where these people are coming from, and not basing it just on the stereotypes, but busting through the myths. And they're finding that it's like the middle school principal.
Yeah.
My brother, he was working in the he's a police officer, and he was working in that unit that was exploring the child crimes, and he went to a class that taught about the computers and how to extract data, and that training that he received from the FBI is part of the reason that they actually were able to catch him. They were thinking that he had been doing it for quite a long time, and they just needed the proof, because he was he had such high standing in the community, like that class really did make a huge difference. And you look at the statistics in that, he was trafficking kids or soliciting pictures from kids, from his own middle school.
Yeah, and it makes it hard actually to, especially with, the service area we have, and trying to get into the schools to work on that prevention education, and knowing that you have youth that have been exposed to this. How do you approach that? A lot of the times the community is really hesitant to, have an organization such as ours to come in and talk to kids, but it's really needed. It's really needed to have those partnerships and collaborations, because as we look at the data is showing that, most of our kiddos have been exposed. They've been exposed in one form or fashion, and they need to know what those resources are. They need to know that, that there's help, and that, you can speak up, and it's
okay to say no, that I don't want to hug, and it's okay to set those healthy boundaries, and that it's a lot of we want our kids to be innocent forever, and that is a great goal. But you can have your child be innocent and still have them know healthy boundaries, and that inappropriate touching is not okay, and that if something feels creepy, trust your instinct, and that if someone is saying, oh, me too, a few too many times, that maybe they're really not being sincere, that, that there isn't a all roses scenario in life, but you don't have to get into the nitty-gritty details, and still you can protect them.
Yeah, and I think the good thing about our organization is that we tackle it on every level. So we can go in with the younger kids and teach them what safe touch looks like. How do you say no? Think about the example of a hula hoop. That's how much space you should have. If someone's invading your bubble, how big is your bubble? You stretch your arms out, and then you keep moving up to those predators. What does predatory behavior look like? How are they interacting in the hospital, in those waiting rooms? Do they look like, a person is hesitant to speak up and say where those bruises came from? Is there strange behaviors that are happening where you maybe want to question it?
Well, just on a very generic level, I'll actually talk about an instance where we had a gentleman who came in, and his girlfriend was in the waiting room, and his stepdaughter was holding his hand the entire time, and just making everybody very uncomfortable. And it would have been nice to have had that training to know how to not invade her boundaries, but kind of be able to say things that are appropriate, but supporting her realizing that, his behavior towards her isn't the most healthy. You know what I'm saying?
Yes.
And that there's opportunities and resources for her.
Most definitely.
I think another myth that is very common is that the myth that most child exploitation and trafficking happens through backroom deals with pimps.
With cell phones being readily available now, that is a method that is being used to get people to bait others and, to exchange inappropriate pictures, monitoring those cell phones and just those sites, even some simple sites such as we see them as harmless, but like Roblox or, just a Fortnite, any method where there's communication that can be had with strangers in a virtual way provides opportunity for that grooming to happen or those behaviors to happen virtually. So it doesn't have to necessarily start off, you walking up and you're introduced to, the big pimp and the big Cadillac, because they're not, we try not to use that terminology, pimp. We use the terminology of trafficker, predator, and oftentimes those predators or those exploiters are the ones that they know where to go. It's not the big Super Bowl scenario. It's the quieter methods, on the phones where there's Instagram, Facebook, different social media platforms. Now a big one is TikTok. Kids are getting into those spaces and they are starting to talk and to speak up about some of the behaviors that have been happening. And it's pretty staggering to see a lot of people, it's working in a positive way for some people to find a voice and just kind of publicly disclose what's happening. But at the same time, we get a little leery about it because we always want to make sure that people are in a safe space. Do they have the supports around them? How do we work with them? What can we do to just kind of support them in that journey, especially working through that trauma? And if you're a youth and you don't know what resources are available to you, who are you going to turn to? Where are you going to go? And there's always a lot of trust issues as well. And so I know, especially coming into an emergency department and just trying to get some support, how do you communicate, or what are some of those telltale signs that tell you that maybe somebody needs some extra support? What can you do to equip yourself? A lot of times what we try to do, especially in our service area, is to make sure that we have those pamphlets available, that we're getting to the point where we're making QR codes, because everyone has cell phones and all you have to do is put your picture up to it, your camera up to it, and it'll take you to those websites. So you have the information available to you readily and fast, because we're getting away from, killing trees and everything is electronic, so.
Well, and I think one of the things that you really pointed out in a very strong way is the fact how predators know where to go. And I think that one of the things as a parent and as a person who isn't wired that or isn't seeking that kind of gratification and wanting that, I don't always think of the fact that these people sit down and they think about, where can I find children? It's like a person who is on methamphetamines and they're looking for methamphetamines. You're going to figure out where to go to get what you want. And I think that that is something that is very powerful, because it's not going to be your kid wandering somewhere and the trafficker, happens to be there. The trafficker is actually looking for them, and in their safe spaces like Roblox and online in their gaming stuff,
Yeah.
and coming up in a mirage, like pretending to be something they're totally not, seeming like their best friend that they've always been wanting. And I think that's something that's hard for kids, is that we all have that sense of needing to belong. And with so many devices and so many screens, it's so easy to feel isolated. It's like, my husband and I talk about it sometimes, when you see a bunch of teenagers and they're all sitting around on their devices and they're all talking to each other, but they're in the same room and they're not even making eye contact with each other, like that disconnectedness of this generation. And even in my generation, you see it, like parents and kids having dinner together and they hardly are like in the same space, some families,
And I think it's important as well is to pick up on those cues. So if your kids are into those social media spaces and video games, it's important to do those checks and say, oh, who are you talking to? Like, who are you playing with? Do you know the people that are on there? And you just kind of listen to some of those conversations, because, it's very strange, sometimes like when my daughter, I have a 10-year-old, and my 10-year-old, she will get on there and you can hear grown men talking. Like, why are you playing with a group of kids in this space? You can only tell, with the voice, and you'll hear the other kids, especially if they've been taught, stranger danger, this, like, why are you here? If you equip your kiddos with some of those tools to kind of know that this doesn't seem right, they're more prone to kind of speak up. And so you want to make it okay for them to have that voice in that space, especially when you're introducing them to new people. And it's like, if you want to keep your house secure, so what do? You make sure that you have an alarm system on it, your car is secure. You always want to make sure that your kids are secure as well. So how do you monitor those interactions? Just having the regular check-ins, talking to them just to see, oh, do you have new friends in your spaces? Just look for some of those inconsistencies, because with social media, we cannot monitor everything, and their kids are so tech savvy nowadays, where they can work through a bunch of firewalls and work through different things to get to those spaces where now that pornography is available to them. There's different things that you can do to kind of try to combat some of those barriers. But I think I always say education is key. Know what to look out for, especially when we're focusing on sex trafficking or exploitation. What does a victim look like? And then you want to think about who could these potential traffickers, who could they potentially be? And it can be anybody, and they're always known. So look and see, are there inconsistencies happening around? Do you see behavior changes that are happening?
Like your child doesn't want to go babysit for a family. Even as a parent, picking up on those cues, like, well, if she doesn't want to babysit there, I'm just going to let her not babysit there, because maybe something's getting weird.
Yeah.
Or say they are all of a sudden not wanting to play basketball, and they've always loved basketball, being able to kind of try to figure out how to have those conversations, like, are you feeling uncomfortable? Or if they don't want to talk about it, even just letting them out of that space.
Yeah, or even coming in with the expensive pieces that that one person can necessarily afford. And so you start asking those questions, because those are some of those grooming behaviors we want to kind of pick up on. So
I want to talk about the fact that the Center for Exploited and Missing Children, that they when all these child trafficking images were coming through and people were reporting them, they started cataloging them, and that there's been 19,300 child sexual exploitation victims identified by law enforcement, and 17% of the victims had self-produced and disseminated the images online themselves. and 31% had been enticed by someone to produce the images. So they made them themselves based on somebody telling them to, and only 13% had been made by parents or guardians.
And that's a big part, like when you want to talk about like social media and people starting that grooming process, meaning basically trying to encourage them to do things that they wouldn't normally do, like, oh, well, send a picture, let's video chat, okay, well, I can't video chat with you, so why don't you send me a picture? And you ask for a picture, and what it turns into is like, oh, well, why don't you show me something else? And then they're like, well, what do you want to see? And it gets more and more in depth to the point they're doing it, or they're being coerced to do it. And once you get to that point of no return, it's like, okay, well, he talked to me, or they talked to me when I was sending them these nude images. And so why don't I start sending them these nude images of myself? Mind you, I'm a youth, I'm underage, and this person is an adult, or it could even be another teen that is using this for, to disseminate or show friends or show other adults, just to get this out. And then once it's shared to one person, they share it to 10 other people, and it spreads like wildfire. We know with the mountains or the trees here, we know how wildfire can potentially spread, and these images spread like wildfire. And now this person's image is being tarnished because of they were being groomed by this individual who's now displaying pictures of a youth.
And I think another thing that when I was reading through the stuff that your organization has provided, they talked a little bit too about how people can weaponize those pictures. You send one, and now they're like, well, if you don't send another, I'm going to tell your mom, and I'm going to tell your pastor, and I'm going to tell all your friends. And then there's all that shame and guilt. And so you keep giving the images to try to keep yourself out of hot water, rather than realizing there's safe spaces that you can go to. And that's another thing where it's really important for parents to have open dialogues with your children, because if there's so much fear and so much shame, they can't come to you, then it can put them in really horrible places. Yeah. We all make mistakes. Is there any one of us that hasn't? So to have that door open, that your children know that no matter what they do, if they ever end up in a situation where they just feel like they just can't come to you, that they always can, that everything is forgivable, Yeah.
And a lot of times you also want to look at those dynamics where they don't have their parents in their life. So maybe they're in foster care, and they don't have much, they're living in a space where there's a fixed income. Mm-hmm. And so you now have this trafficker who's identified that. They see it. And so they start with the gifts. And it's like, oh, you're my girl, you're my boy, you're going to hang with me. I'm going to buy you the nice things. And you start with all those gifts. And now you owe me. You owe me. And how are you going to pay that? Okay, well, I want you to go this harmless dinner date. You have to go on this dinner date with someone for me. And what are you doing? You have this predator who's exploiting this youth, because now they feel like if they don't go, they're going to have to return those gifts, or there's gifts that have been provided to them that they can't return. Oh, I'll give you a ride home only if you do this. There was a situation where just in trying to provide transportation to an individual, they were basically sexually exploited, because in order to meet their need to get to a treatment center, the driver said, oh, well, if you want to ride, you want cigarettes, okay, well, I want to have sex with you, and I'll purchase you cigarettes so then you can go into treatment. And it could be some of those basic needs. And sometimes these are vulnerable individuals, sometimes with mental disabilities, they don't have people looking after them. And we're looking around and we're like, you should be safe. You're in the care of a transportation, that we called for you, not knowing that now this person is exploiting this individual. So it can happen in so many different scenarios, but we just have to be open to that. And I think the biggest thing is always believing survivors. When a person comes in, and do you have to visibly see that a person is having a heart attack in order to trust that if this is what they're saying, is that's how you're going to treat it, right?
Yeah.
So if a person is saying that something has happened, for our organization as advocates and working with victims of sexual exploitation or sexually exploited youth, majority, we believe what they say and we treat it accordingly. We walk them through the process and we give them the supports that they need. And I think for any individual that's going to make any interactions, you really need to believe folks,
I think that is a great piece of advice for nurses, because I think we, especially ER nurses, we kind of get to be a cynical group. And I think that sometimes when we see people acting out, like people who are doing or experience trauma, who have that feeling once they get trapped or feel like they're not believed, being educated about the trauma-informed care and understanding what are the symptoms and the signs that someone is being trafficked or that they could be coming from a place of trauma. It's some tools that we all need in our toolbox. And I think that it's really great that your organization is willing to partner with us and start to give us those pieces of information that are crucial to us being a big part of the solution,
Oh, yeah. Yeah, it's important, especially when, you have a person that's constantly coming in and they're always over medicated. Sometimes we forget that maybe there's other traumas that they're trying to work through. Maybe they're just tired of feeling. And so they're coming to the emergency room to try to meet one need. And then you identify an issue, maybe an exploitation issue that you would want to connect them with the most appropriate services. And how do we do that safely? How do we do that securely? What do we do to equip our spaces to be inviting and allow people to come in and share their stories, or just to receive the services, or even just to be able to be handed a resource?
Well, and I think another thing, too, that as a nurse, and I think this applies to every nurse, no matter where you work, once a child is trafficked, once a person is a survivor of some kind of sexual trauma, that never goes away. That is something you carry with you. And so having that ability to provide that trauma-informed care, being able to have those conversations of like, what do you need from me so that I don't re-victimize you? Those kinds of pieces in learning about trauma-informed care and learning about what traffickers need from their own mouths, because that's one of the things that Support Within Reach and a lot of the exploitation information that is coming out is from survivors. It's from people who have had to, take their stories and take the brokenness and make it into something that can help other people. And that strength and that information is so valuable to the world and to us as nurses.
Yeah, and it, just listening to some of the stories from some of the people that we've helped throughout the years, I think the biggest thing that really stands out is hearing them provide thank you for just listening and believing their story. Just listening, because a lot of times, we hear stories of people being turned away or like, oh, you're okay, you're fine. And they're just looking for an out. They're looking for someone that is willing to listen to them, because a lot of times, how they say the boy who cried wolf story, where you have, you continue to cry wolf, and then that final time, don't show up. But they really need the support. And, when we look at victims in that cycle of abuse, how many times does it truly take them to take that resource? I would rather provide that resources to that same individual 7 to 10 times and know that eventually one of those times it's going to click and they're going to use the resource, because it's up to them to decide when they're ready for that support. It's not our decision to take away their right or their decision. If they want to report, if they want extra supports, we're just there to listen to them and to meet them where they are. And that's a big part of just the trauma-informed care that everyone should be working towards, because I know when we're in an emergency situation, we want to make sure that you're okay, that you're going to survive, but we don't look at what it's doing internally to people who've been victimized, to youth, to children. They're trying to figure out that, and it takes a lot of community partners. It takes the whole village to kind of come together and support on different levels. So just being open to the conversation, I mean, it means a lot, because it just shows that we're growing as a state. We're really coming together, and just to have that presence, it's really important, just to see that we have people partnering to work to end in this pestilence.
Yep. And I think that we need to continue to work together and not try to always do our own thing. You look at Safe Harbor and how it was created, in 2011 or 14?
2011.
Yep. So when Safe Harbor was created in 2011, you look at the work and all the wonderful things that have happened since then. And it's really exciting to come alongside of that and see where it can go from here. I mean, you look at the legislation that can happen. You look at what other states are doing. Really, the sky is the limit. And, one of the things that's exciting is that as a union, with 22,000 nurses, if we all come together and we all decide that this is our issue, we really are throughout the states. We can be eyes, we can be ears, we can be community members, we can be people who are willing to testify about the importance of passing that law or requiring whatever it needs the survivors tell us, by listening and seeing their needs and knowing that they need us to come alongside them, because that's what nurses do. We come alongside people and we help them define their best reality. And I think this group of humans, survivors of child exploitation, are exactly needing that. And I think that as nurses, we see them and we want to help them. And sometimes we just don't know how or where. And it's really exciting to come together, you and I, and have this podcast to start those conversations, to let people know that they can start by coming to these classes. And in these classes, as they learn stuff, they'll figure out where they want to plug in even more, like you're talking about doing the general class, and then also doing the non-sane ER class. And for people who don't work ER, SANE is sexual assault nurse examiner. There's a paid course that people can take, but in rural areas like critical access hospitals or even in regular ERs, people don't usually get trained for that. Not everybody, because it's a very specialized thing. You walk alongside people who've been sexually assaulted or are victims of abuse, and it's a legal portion of it as well as the psychosocial, emotional portion of it. So the non-sane ER training is something that I know my coworkers and I have talked about a lot, because you want to be there for these patients. You want to do the best for them, and you want them to have their best life after such a tragedy. And it's such a dark time.
Yeah. And it's important also to kind of really focus too on some of those implicit biases, like when we look at just removing our unconscious biases and looking at good victims versus bad victims. Like, oftentimes we attribute those good victims as, most to none, a white female. They're vulnerable, young. This victim is innocent, must have been kidnapped. Oftentimes, sometimes the victim is grateful for being rescued and ready to leave the trafficker. They are a U.S. citizen and an English speaker, but then a lot of those bad victims, persons of color, juvenile delinquency, or they have a criminal record, the LGBTQI or gender nonconforming. Victim defends their exploiter. They're undocumented immigrants. Males can't really be trafficked. If they're sex trafficked, they must be gay or they enjoy it. But these are all victims, and we have to look at that in those retrospects, especially when we're treating patients or when we're working with our clients. We cannot and should not allow those biases come into play when we're looking at believing individuals and trusting what they're saying, because a lot of times we always ask ourselves, well, why aren't they leaving? Why do they continue to go back to their traffickers? A lot of times that we attribute that to fear. We look at the dependency or the psychological factors. It's my choice. I'm making the choice to stay here. I'm the one that, I'm not going to go back to that life. Maybe they were having a harder life and they find shelter, either getting shelter from this trafficker. Maybe they're afraid of being blackmailed. There's so many different reasons why some victims won't leave the situation. And a lot of times we have to look at Maslow's hierarchy of needs and, see, like, are their basic needs being met? Oftentimes they're not,
And realizing that the shame and guilt that come with being a victim of trafficking, and now you're just supposed to go back to a normal life and pretend like this didn't happen. That's something that's so overwhelming, I think, for a lot of people, that they know their life, they know their enemy when they're with their trafficker. I can handle this. I don't know if I can handle the survivor road. And sometimes I think that 1, 2, 3, 4 times of compassion can then help them see that road is a beautiful road and not a scary road full of judgment and bias and, nobody willing to help you. So now I don't have food. I don't have a place to stay,
Yeah, because they knew where they stood in those spaces. They knew they were going to be abused. They knew they were going to be hurt. They knew they were, that this is going to happen regularly. But in that healing process, they're reintroducing those feelings, like, I'm feeling now. I'm having to process things. I'm having to work through this. And sometimes it seems hard. That's why we want to connect people with the most appropriate services. And like I said, it does take a community. And, just knowing what those resources are in your communities, that can make a big difference. That can truly make a big difference. And the more connected you are to the community and engaging into the community, like, we have different events that go on throughout the year that, like April Sexual Assault Awareness Month, and
Well, don't forget to tell them about they're having a event in Bemidji. That sounds like a really great event.
So we're having a Take Back the Night event that's going to be April 24th, and that's going to be at BSU Fire Pit, and we have victims or survivors come and they tell their stories. We light candles. We have a presence there from every aspect of the community. Our different SMART teams will be there. And that's just basically a collaboration in the community where everyone just kind of talks about, how they work as a collaborative to end sexual exploitation, sexual violence, and those different areas. And I think it's really important for us to kind of make sure that we're doing all that we can to get to a space where we're supporting one another, and we're creating a space where individuals feel supported, and they feel like they're getting the response that they need and they know that it's a community space where the community's there and we're working as a collaborative to end sexual violence.
I think that as nurses, I think that is one of the things that bringing forth the sexual exploitation of youth as an organization and making it a resolution, it gives us a space within our own organization to figure out like how we can come alongside. And I just so appreciate the fact that the House of Delegates sees how great a work that is and what a positive impact as nurses we can have in the community, and how, you know, with our bargaining units and our bargaining systems, we do hook in with legislators. We do hook in with our local community political people, so we can have those conversations. We can be talking to our doctors. We can be talking to our pastors. We can be talking to our friends about how important it is that we stop this pain. You know, children should be able to be children. And I think sometimes people think that the best way to do that is to put their head in the sand and just avoid this topic, but they're actually stealing their child or stealing children's innocence, because it's only in a space where the boundaries are set and where traffickers know that everybody's watching, that children are actually going to get their childhood back.
Yeah. And just to correct a little bit on the date of that event, it's actually April 21st. It's a Thursday. It's from 6 to 8, and that's at Bemidji State University, the Hobson Lakeside Fire Pit. That's 1500 Birchmont Drive, Northeast Bemidji. So if you're wanting to come and just be a part of a night of healing and just be there to support someone, or even if you just know somebody or you're just there to support your community or even a neighboring community, you know, there's these different events that are happening, and I think it's important to just kind of link up and see what you can do to at least bring awareness in your spaces. Bring awareness so that way people at least know where those resources are, and that they can, you know, work on being a voice for someone or helping someone to identify that they do have a voice and there are supports available.
And people who are victims of trafficking, they look around and they see who's around. And if they see nurses at these events and then all of a sudden they're in emergency rooms and they're getting care, they're going to be like, hey, I recognize that lady. You know, this is a safe person. This is someone who values me and values healing. And they might just take that pamphlet.
Yeah.
And that it's time well spent.
Yeah. And that says a lot, you know, just having that presence in the community on one level, and then just knowing that you're a safe space. You're a safe face. You know, that they know that you can understand a little bit of what they could potentially be going through. And I think, you know, the more we're in the community and we're showing that we want to be supportive, that's why we do a lot of tabling events, you know, with the youth. We're in the Boys and Girls Clubs. We're talking to the kiddos. Like, we're very present in the communities, you know, that we service, so that way they see us on a good space, because when we get the ER calls and we're showing up, you know, then they know that, oh, I saw him at this event here. And so, you know, there's that sense of, you know, like, okay, I know them in a way, you know.
And I think that's such a great point for nurses to get this training and to become informed with the dialogue, because we already are out in the communities and we can be those safe spaces and we can be those safe people, because our community sees us and they know we're nurses. And being able to, if someone approaches you, to have the words and to know how to speak into their lives and give them the resources they need and reach out to them in meaningful ways, that is empowering. You know, nobody wants to be sitting in a chair where somebody comes up and reaches out to you and you don't know what to say.
Yeah, exactly.
So we really do appreciate your guys' support and the willingness to come alongside of us and try
Most
to
definitely
work together.
So, Wendy, you have talked a little bit about some classes that are coming up for MNA nurses that we're presenting. Can you say a little bit more about the details about those?
I'd encourage nurses to attend an upcoming series of trainings that MNA is hosting, starting with the 90-minute presentation from Evett on April 13th, 10 a.m. via Zoom. We are also planning another training about trauma-informed care and a third class about communicating with the survivors of trafficking. So keep your eye out. It'll end up being in the Vital Signs, MNA Vital Signs, or your email. Or you could go to the website and look at the calendar. They have a lot of great events, and we would definitely be on there as well.
Yep, you can actually register on the MNA website. Go to mnnurses.org, then go to resources and click on education, and you'll see all of the classes that MNA offers. These are all free for MNA members and will offer contact hours. Evett, what are some resources people can use if they or someone they know is being exploited or trafficked?
So Support Within Reach is one of the state of Minnesota's Safe Harbor regional navigators, and we connect youth with services and serve as a point of contact in the communities. You can find more information at www.supportwithinreach.org, or you can call our hotlines. We have 1-800-708-2727. And we also have another hotline. It's 1-866-747-5008. Or you could, to find services anywhere in Minnesota, you can call Day One Crisis Hotline at 1-866-223-1111 or text 612-399-9995, or visit the Day One website at dayoneservices.org. And also, don't forget to like, follow, and share all of our different social media platforms. We have Facebook, Instagram, Twitter, LinkedIn, and also our YouTube channel. We always have information on there daily, if not weekly, and we really push a lot of information as it relates to sex trafficking, sexually exploited youth, and just the work that's done throughout the community. So if you can use those resources, or you can forward those resources over to someone else, you could potentially be saving someone else's life. So like, follow, and share.
Another important number for people to be aware of is the number for the National Center for Missing and Exploited Children. Their cyber tip line, it is 1-888-373-7888, or you can text Be Free, which is 233-733, or you can chat at www.humantraffickinghotline.org. One of the things to remember about the nationwide site is that it can be used for tips too. If you come across child pornography, if you happen to suspect that a domain is targeting children, that's where a lot of the leads are given to the local law enforcement.
Well, Wendy and Evett, thank you so much for all of this great information and this good conversation. It's such an important topic, and another example of the way that nurses are really in a unique position to be able to help people heal so they can go on to survive and thrive and have a good life. So thank you so much for everything today, and thanks for listening, everyone.
Thank you, everyone.
Us. Thank you.
Thanks for listening to MNA Power in Practice. Be sure to subscribe to the podcast through your favorite streaming service so that you don't miss a single episode. Want to get in touch? Email power.practice@mnnurses.org for more information.